Assalamualaikum viewers and welcome back to our channel Biodenverse Hub. Today in the playlist of oral and maxillofacial surgery, we will be discussing about the same prevention and management of extraction complication. So in that series, our today's video will be about injuries to the adjacent structure, in which we will be studying the injury to the regional nerve and injury to the TMJ. So let us study the injury to the regional nerve first. Frequently, the branches of the fifth cranial nerve, they are injured and that are as follow. First of all, let us study the mental nerve. So the causes for it are surgical removal of the mandibular premolar roots or any impacted mandibular premolar. As you know that in the region of the premolar, we have the mental foramen and the mental nerve passing. So you could easily injure that nerve during any kind of procedure performed out there in that region. Any kind of periapical surgery in the area of mental nerve and foramen can also result in injury to the mental nerve. Now, how can we prevent it? If the three-corner flap is to be used in this region, you should give the releasing incision far anteriorly. So what is basically the consequence of this injury? The patient will experience the paresthesia of the chin and the lip. If the injury is a result of flap reflection, the sensation will return back in a few days. But if the nerve it is injured along its course or exit point, then it is a permanent paresthesia and a permanent damage. So the second important branch that could be injured is the lingual nerve. Again, the causes for its injury involves the surgical extraction of mandibular third impacted molar, as lingual nerve passes on from that region and there are high chances that we can injure the nerve out there. Or excessive stretching or dissection of the tissue on the lingual aspect of the retromolar pad area could also result in injury to the lingual nerve, as it is the region where the lingual nerve is moving along and it is passes out from that region. So how can we prevent injury to the lingual nerve? First of all, surgical exposure of the impacted third molar is to be made buccally. Avoid stretching and incising on the lingual aspect of the retromolar pad area, because that is the region where there are high chances that you could injure the lingual nerve on the labial aspect of the retromolar pad area. So avoid incising on the lingual aspect of the retromolar pad area. Now, what is the consequence of injury to the lingual nerve? It is that the lingual nerve rarely regenerates. If it is injured or damaged, it is a permanent damage out there. Another important branch that could be injured is the inferior alveolar nerve. It could be injured during extraction of the impacted third molar, mandibular third molar. And you can prevent it by taking a radiograph or CBCT in order to know its exact location, and then you could perform the extraction safely by avoiding any injury to the inferior alveolar nerve. So this was all about the injury to the regional nerves. Now we will be studying the injury to the TMJ. First of all, what are the important causes? Any excessive force application during the extraction of the mandibular molars. There are high chances that you could injure the temporomandibular joint. Or inadequate support of the mandible during the procedure, because it is usually recommended that you need to support the mandible while performing out the extraction of your mandibular molars that require the excessive forces. So if you are not supporting the mandible, there are high chances that you will get an injury to your temporomandibular joint. Or third important cause is that opening too wide for a long period of time. The patient has opened the mouth too wide and it is open for a long period of time, then the muscle they get stretched and there is a strain and injury to the temporomandibular joint. Secondly, how can we prevent the injury to the temporomandibular joint? So first of all, controlled amount of force application. Secondly, you need to support the mandible either by your opposite hand at the lower border of the mandible or either by placing a bite block on the contralateral side. And third important preventive measure is that do not force open the mouth too widely and do not make it to remain open widely for a longer period of time. So these are some preventive measures that you could use in order to avoid the injury to the temporomandibular joint. Now, if the injury to the temporomandibular joint has occurred, so what will be the management protocol? The management include if patient complain of the pain in the TMJ immediately after the extraction, then you could use the moist heat. You could recommend the patient the soft diet and ibuprofen 600 to 800 mg 4 hourly for several days. If the patient who cannot take NSAIDs, you can also prescribe acetaminophen, that is 500 to 1000 mg in the dosage. So this was all about the management of injury to the TMJ. I hope this video will be helpful for you all. Don't forget to subscribe to my channel for more videos and updates. Thank you.